Thanks, Logan. Well, the dentist and staff at Columbia Dental in Manchester are volunteering their time this Sunday to help a fellow coworker in need. Dental assistant Rhonda Ginsburg Danino is a breast cancer survivor, but she needs this surgery to continue fighting the disease. And this weekend, you can help in her fight. Rhonda is here now, along with Dr. Angie Salner from Hartford Hospital's Helen and Harry Gray Center to talk about this weekend's event. Also, Rhonda's diagnosis. Thanks for coming on the show.
Hi, thank you.
Rhonda, tell us your backstory when you were diagnosed with breast cancer, because now you're cancer-free.
Yes, I am.
So congratulations on that.
I was diagnosed 12 years ago.
Okay.
I had a mammogram after they did a lumpectomy, and I had radiation and 5 years of tamoxifen, and decided that I wanted to give back, so I signed on to a research program.
All right.
And have been just doing whatever they need to hopefully help someone else.
So now you're about to go through with a double mastectomy.
Yes, I am.
Before I talk to you, Doctor, talk about why Rhonda is good for this double mastectomy and what kind of patient should go through something like that, even though she's cancer-free.
Well, Sarah, about 10% of women with breast cancer carry one of the BRCA genes, either the BRCA1 or 2 gene. And women might know that they're at risk for carrying a gene because they have a first-degree relative, a mom or a sister with breast cancer, particularly breast cancer that happens at a premenopausal age. They may have multiple relatives, or they may have bilateral breast cancer, a dad with male breast cancer, or other cancers in the family. All may be an indication that there's a BRCA gene. You don't know until you actually get counseled and tested.
Okay.
Rhonda was tested. She was found to have one of the BRCA genes, and really then now knows that she has somewhere between a 60 and an 80% risk of getting breast cancer again. So the question is, what should she consider doing to help prevent a second cancer from forming? And it really becomes a very personal decision once you're armed with the information.
So, Rhonda, what made you decide to actually go through with this rather than wait it out with that 60 to 80% chance?
All the reports and all the statistics with the high percentage rate, and 4 opinions, and actually I do have a cyst on the other side now, which is still benign, but it just was all right there.
So what are your family and friends saying? They're in full support of this?
Oh my God, it's amazing. You know, something so bad turns into something so wonderful. Everybody, it's just amazing.
Yeah.
It's a very alone thing when you first diagnosed, and then you look around and there's so many people there that support you.
Yeah, we had Race for the Cure this weekend on Saturday. It was amazing how many people are out there.
Beautiful.
It affects so many people in different ways. Dr. talk about the Helen and Harry Gray Center, what you do for patients.
Well, the Helen and Harry Gray Cancer Center is the largest breast cancer provider in the state, actually. We diagnose and treat over 700 women with breast cancer each year, representing about 25% of the breast cancer in the state. And we have a multidisciplinary team, Sarah, that spans everybody from diagnosis all the way through treatment and support. That includes a team of doctors of all specialties, survivorship nurses, research nurses, the whole team. And our goal really is to not only provide state-of-the-art diagnosis and treatment for patients, but also to help support them during their journey. And as you know, a lot of this is all about community. It's about support that you get from your healthcare team, not only during the treatment but after, because part of it is getting back into some sense of normalcy again. But a lot of what this event is about certainly is about community and about support for someone who's going through it, because we all have a family member or a friend who's been through it, and we know how much support it takes to help them.
So let's talk about the event. How can people come out and help? It's this Sunday.
It's this Sunday, June 12th. It's going to be at Columbia Dental. 483 West Middle Turnpike.
Yeah. All the information on our screen right now. We'll also have it on our website from 8 a.m. until
12 noon. There's going to be all dental work, whether it's a cleaning or fillings or crowns or root canals, all the benefits go into a fund to help pay for medical insurance. There's Reiki, there's Zumba classes.
Oh, really?
Oh, yes.
How fantastic.
Nails, manicures. I don't even know half the stuff that's going on. I'm not really in the full loop.
Well, Rhonda, good luck with everything. Thanks for coming on this show. Doctor, thank you so much. We appreciate it. Well, again, we'll have all that information on our website, ctnow.com.